Here is something that should stop you cold. Right now, at this exact moment, a person is going about their day completely normally. They woke up this morning, they had breakfast, they are walking, talking, functioning, and they have no idea that one of their major arteries is 70% blocked. No chest pain, no dramatic warning, no moment that made them think something was wrong, just a quiet, invisible narrowing that has been building for years and is now one small clot away from a heart attack or a stroke. I have watched this happen more times than I should have. And the part that never gets easier is this. In almost every case, the signs were there. The body had been sending signals for months, sometimes years, but nobody told that person what those signals meant. So they ignored them. They assumed they were tired, or getting older, or just stressed. And by the time they arrived in my emergency department, the window to prevent the damage had already closed. My name is Dr. Miles. I have spent 13 years as an emergency medicine physician. I have seen what arterial blockages do to a human body when they are caught too late, and I've seen what happens when someone catches the signs early enough to act. The difference between those two outcomes is not luck. It is knowledge. And that is exactly why I am making this video today. If you are not subscribed to this channel, please do that right now. Hit subscribe and turn on notifications. Every week, I release clinical information built on 13 years of frontline emergency medicine, the kind of information that most people only hear after something has already gone wrong. Subscribe now. Then stay with me, because what I am about to share could be the most important thing you watch this year. What is actually happening inside a blocked artery? Before we get to the signs, I need you to understand the mechanism, because once you see it clearly, the signs will make complete sense. Picture your arteries as pipes. Not rigid metal pipes, but living, flexible tissue designed to carry blood smoothly and efficiently to every organ and muscle in your body. Now imagine that over years, from inflammation, from oxidized cholesterol, from high blood sugar, from chronic stress, a substance called plaque begins to accumulate on the inner walls of those pipes. Slowly, silently, without a single symptom in most cases. As that plaque builds, the pipe narrows, blood flow reduces. And here's where your body begins to speak quietly, through signals most people are never taught to recognize. Your heart strains to push blood through a narrowing passage. Your muscles receive less oxygen than they need. Your brain gets fractionally less blood flow than it should. And the body, in its extraordinary intelligence, begins to compensate, masking the problem, while simultaneously leaving clues everywhere. Those clues are what we are talking about today. And number 4 on this list is the one that catches almost everyone off guard. Sign number 1, unexplained fatigue that rest does not fix. This is the most dismissed sign in emergency medicine and the most dangerous one to dismiss. When an artery is partially blocked, your heart has to work significantly harder to deliver the same amount of blood your body needs. Think of it like trying to water a garden through a partially kinked hose. The pressure behind the kink builds. The delivery on the other side weakens. Your heart, which is a muscle, fatigues under that sustained extra demand. The result is a specific kind of exhaustion, not the tiredness that comes from a long day or a poor night of sleep. This fatigue is bone deep, persistent, and disproportionate to your activity level. You wake up tired. You rest and still feel tired. Activities that used to feel easy now feel like effort. Most people blame age. Most people blame stress. And in many cases, those are exactly the right explanations. But when fatigue is unexplained, persistent, and accompanied by any of the other signs on this list, it is a signal your cardiovascular system is working too hard. It deserves medical attention, not dismissal. Sign number 2, jaw, neck, or shoulder discomfort. This one saves lives when people know it, and costs lives when they do not. Most people believe a heart attack always announces itself with crushing chest pain. That is the Hollywood version. The clinical reality is far more varied and far more deceptive. In a significant number of cases, particularly in women and in people with diabetes, the discomfort from a compromised arterial blood supply does not appear in the chest at all. It appears in the jaw, the left shoulder, the neck, sometimes the upper back. Here is the mechanism. The heart and these surrounding areas share overlapping nerve pathways. When the heart is under ischemic stress, meaning it is not receiving adequate blood supply, the brain cannot always accurately identify the source of the distress signal. It interprets it as coming from the jaw, the shoulder, the neck instead. This is called referred pain, and it is responsible for an enormous number of misdiagnoses, people who spent hours treating a sore shoulder or a stiff jaw before anyone asked about their heart. If you experience recurring discomfort in your jaw, left shoulder, or neck that has no clear muscular explanation, that has no injury behind it, no reason to be there, take it seriously. Especially if it appears during exertion and eases with rest. That pattern is a red flag. Sign number 3, shortness of breath during ordinary activity. Your lungs are not working harder. Your heart is. When blood flow is restricted through a partially blocked artery, the heart's ability to pump efficiently is compromised. Fluid can begin to accumulate around the lungs. Oxygen delivery to working muscles decreases. And the result is a sensation of breathlessness that appears far earlier than it should climbing one flight of stairs, walking across a car park, carrying groceries from the front door. Think of it this way. Your body is a machine running on a restricted fuel supply. It can manage at rest. But the moment you ask it to perform even mildly, the gap between what it needs and what it is receiving becomes impossible to hide. If your breathlessness has changed in the last 6 to 12 months, if activities that once felt effortless now leave you noticeably short of breath, that change matters. Do not normalize it as fitness loss or aging. Have it investigated. Sign number 4, calf pain or cramping when walking. This is the one most people never connect to their arteries, and it is perhaps the clearest physical signal the body can produce. The condition is called peripheral artery disease. It occurs when the arteries supplying blood to the legs become narrowed by the same plaque process affecting the coronary arteries. The classic presentation is this. You begin walking, your calf tightens and cramps, you stop and rest, the pain eases, you walk again, and it returns. This is not a muscle problem. This is your leg telling you it is not receiving adequate blood supply during exertion. And here is why this matters critically. Peripheral artery disease in the legs almost always means the same plaque process is occurring in arteries elsewhere in the body, including the heart and the brain. It is a window into your entire vascular system. People spend years treating this as a circulation issue, a muscle cramp, a fitness problem. It is none of those things. It is your cardiovascular system asking directly for attention. Sign number 5, dizziness or lightheadedness when standing. When an artery supplying blood to the brain is partially compromised, positional changes, standing up quickly, turning your head, rising from a chair can produce brief but meaningful drops in cerebral blood flow. The result is dizziness, lightheadedness, or a momentary feeling of being about to faint. On its own, this can have many explanations: dehydration, blood pressure medication, inner ear issues. But combined with any other sign on this list, it becomes part of a pattern that demands investigation. Your brain is the organ least tolerant of reduced blood flow. Even brief, repeated drops in cerebral circulation can have cumulative consequences. Never dismiss recurring dizziness as simply getting up too fast. Ask why it is happening. Demand an answer. What to do now? These 5 signs: persistent, unexplained fatigue, jaw or shoulder discomfort, breathlessness during ordinary activity, calf cramping when walking, and recurring dizziness are your body's language for a problem that is entirely treatable when caught early and catastrophic when ignored. You do not need to have all 5. You do not need the symptoms to be severe. You need to recognize the pattern and act. See your doctor. Ask for a cardiovascular risk assessment. Request a lipid panel, a blood pressure evaluation, and if warranted, imaging. Push for answers. Your instinct that something is not right is a clinical data point. The person who arrives in my emergency department after a heart attack almost always tells me the same thing, that they noticed something weeks or months before, that something felt different, that they almost made the appointment but talked themselves out of it. Do not be that person. Make the appointment. If this gave you something real today, subscribe to this channel right now. Share this video with someone you love who has been dismissing signs they cannot explain. You watching this and passing it on could be the reason they act in time. I am Dr. Miles. Your arteries are speaking. Now you know how to listen. I'll see you in the next video.